In this video, I'm going to discuss why you most likely don't need surgery to treat vocal fold nodules. Having a diagnosis of vocal fold nodules can be really frightening for most people, especially performers and singers and professional voice users. And that's because you may have noticed changes in the voice anyway, so that's already making you wonder what's going on. And then you have a confirmed diagnosis that there's actually some swellings on the vocal folds. But actually, vocal fold nodules can be resolved. They sometimes can be resolved quite quickly. More typically, they take a good couple of months of therapy, 2 or 3 months sometimes, to resolve. And the smaller they are, the easier it is to resolve them. So that's why therapy should be the first port of call, because with the right techniques and training and practice with a professional, the person learns to use their voice a bit differently and understand the voice. And because of that, vocal fold nodules are unlikely to return. Now, traditionally, surgery was the first port of call for many people because it was just seen as, oh, well, there's some swellings there, and the ENT surgeon would then take them away, and then, oh, look, the swellings aren't there. And for a while, the voice could be better, actually, and I'm sure in some cases that change might last. But in the vast majority of cases, it's much more likely that vocal fold nodules will return after surgery if other issues haven't been addressed. So in many ways, surgery was a quick fix. But it started to become apparent to both doctors and to therapists that very often people would come back with vocal fold nodules. So we went down a road then of treating it with therapy first as the first port of call, because very often then they wouldn't return. They can return, but it's important to do a complete course of therapy to try and resolve the issue. It usually involves making behavioural changes with the way you use your voice. And of course, that takes a bit of time and a bit of practice, but it leads to lasting change. By changing vocal habits and the way you're using your voice, and just understanding how to keep your voice safe and how to look after it, all these things promote a lasting change and put some power back into the hands of the person, rather than just wondering, how will my voice be? While surgical removal of the vocal fold nodules will create a clearer voice for most people, certainly for some period of time, the likelihood of them returning is strong, because the reasons why the nodules formed in the first place has not really been addressed. And that's the type of thing that therapy does. And it can be still quite a quick process, but it leads to much deeper understanding of how to take care of the voice going forward, and further sometimes just how to develop it. So maybe before it was always difficult to use your voice more loudly, but therapy can help you learn a safe voicing technique that will prevent the nodules reforming usually. One of the reasons we don't advocate surgery first for nodules nowadays is because all surgery carries with it a little bit of risk. So in vocal fold nodules, removal of them will leave a little bit of scar tissue. Now, it's often very tiny, and for people who aren't professional voice users or singers, then a little bit of a voice change, a tiny bit of voice change, is not going to be a real issue for them. But for people like singers or actors or people who use their voice professionally, it's usually better to avoid having any scar tissue on the vocal folds and to try and remove any kind of problems with the voice in a more natural way, from a therapeutic kind of perspective. So we always try and keep the voice as intact as possible. And of course, therapy doesn't actually directly go in and touch anything on your vocal cords. It's just learning to change the way you use your voice and to do some exercises to strengthen the voice and restore the comfort and the function of the voice. And so it's much less risky. There's no risk really, except that perhaps it might not work. But generally, by sticking with it for a few sessions, people will generally always see some improvement. So bringing all those points together, I think the real value of therapy is that it's a really holistic approach. We look at a variety of factors when we're working with somebody who's got vocal fold nodules, not just the way they use their voice, their behavioural voice use when they're speaking, but actually their lifestyle factors as well, such as somebody who uses their voice a lot for work. Maybe their hobbies involve voicing, and they also talk for a lot for a living. Perhaps they don't take great care of their voice, they don't drink very much. So all these things come into play when we're working with somebody with nodules. So we look to address and balance things that might be influencing that voice problem. So it's a more holistic approach, drawing on all the factors that I mentioned before, and a low risk approach that leads to lasting change. And so for all those reasons, that's why voice therapy is the #1 approach to treat vocal fold nodules. If you like this video, press the like button and subscribe to the channel.